Here, I am going to focus about the hypoglycemia. Hypoglycemia means a blood glucose level when less than 70 milligram per dl or 4 millimole per liter, right? So when patient blood glucose level go drop, patient usually present with some sign and symptom, right? That helps to indicate they have hypoglycemia. And when you read the book, and some books said the blood glucose level when less than 60 milligram per dl, we called hypoglycemia. So what are the conditions patient have to face the sign symptom of hypoglycemia? Like occur as a result of too much insulin. Like your patient diagnosed with diabetic mellitus or hyperglycemia, and patient supposed to take insulin. If the insulin is too much or not enough food or excess physical activities, patient chance to develop the sign symptom of hypoglycemia. What are the common sign and symptom? In this picture here, first one here, sleepiness, sweating, we call diaphoresis, pallor, or lack of coordination, irritability, also hunger. So the symptoms included headache, nausea, I just recap it, sweating or diaphoresis, tremor, lethargy, hunger. Patient feeling increase a lot of, increase the appetite or hunger, and also patient still feel the tired or lethargy, tachycardia, confusion, right? Also tingling around the mouth and anxiety. Also, patient level of consciousness will go down. Difficulty of concentration, even difficulty of speech, and the very late stage, patient develop seizure and coma, right? So this is the common sign of hypoglycemia. Now we're going to focus how we take care of the patient if they develop hypoglycemia. Intervention for hypoglycemia. When you take care of the patient hypoglycemia, we make sure my patient is conscious or unconscious. So if the patient develop the hypoglycemia, as a healthcare provider, we must know the management of hypoglycemia. First of all, I want to explain a short note. The patient who hypoglycemic, we categorized them, they are conscious or unconscious. So if patient is unconscious, we never ever give anything to the mouth. Better go for intramuscular or subcutaneous administration of glucagon, right? And also we repeat in 10 minutes if blood glucose level not change. So repeat in 10 minutes if patient is still not conscious. So once patient is conscious and can swallow safely, have the patient consume a simple carbs or carbohydrate. If the patient is conscious, patient is able to take orally, it is good to consume 10 to 15 gram carbohydrate or 4-ounce juices, soft milk, or 8 ounces of milk. And we recheck the blood glucose frequently or follow with a complex carbohydrate. Let me read what our NCLEX textbooks said. If possible, confirm the hypoglycemia with a blood glucose reading. Administer glucose immediately, and rapid release glucose is followed by complex carbohydrate or protein. Give an extra snack if the next meal is not planned for more than 30 minutes or if activity is planned. If the child becomes unconscious or if we see the glucose paste onto the gum and retest the blood glucose level. So when we check the blood glucose in 15 minutes. So if the reading is still low, we administer additional glucose. If the child remains unconscious, the administration of glucagon may be necessary. In hospital, we administer dextrose intravenously if the child is unable to consume an oral glucose product. In this table, we can see the food list, what we need to follow for our patient. So food items to treat for hypoglycemia. We can choose half cup of orange juice or sugar sweetened carbonated beverage, 8 ounces of milk, or a small box of resin, 3 to 4 hard candies, or 4 sugar cubes, or 1 candy bar, 1 teaspoon honey, or glucose tablet. So now here, hypoglycemia in a hospitalized child. So check the child blood glucose level and give the child half cup of fruit juice or other acceptable items. Take the child's vital sign, retest the blood glucose level, and give the child a small snack of carbohydrate and protein. Document the child complaints or action taken and also the outcomes. So if we know how to manage the hypoglycemia, it is also good to know about management of hyperglycemia or what are the other complication causes like diabetic ketoacidosis. It is the opposite of hypoglycemia, is the hyperglycemia. When blood glucose level more than 200, and some book says when blood glucose level is more than 250 milligram per dl. So, or 11.4 millimole per liter. So, easy way to remember the hyperglycemia sign and symptom, it is 3 P's. 1 P stands for polyuria, 1 P for polydipsia, and 1 P for polyphagia. Polyuria Poly means a lot of urine. Increase the frequency of urination. Polydipsia means a lot of thirsty. Increase the thirstiness. And polyphagia means a lot of eating. Increase the hunger. Right? So patient eat, but their body weight loss. Patient eat, but they still tired, fatigue. Increase the frequency of infection, rapid onset, and we found more common dehydration. So how you understand the dehydration? We check the skin trigger, weak pulses, or dry mucous membrane. And also the fruity breath water we call Kussmaul respiration. What is Kussmaul respiration? Increase the rate and depth of respiration. Some patients complain nausea, weakness, and lethargy. Let me read it. Signs include polydipsia, polyuria, polyphagia, or difficulty of vision, weakness, weight loss, and syncope, right? So NCLEX tips, a common question NCLEX would ask, in case of hyperglycemia or diabetic ketoacidosis, what are the characteristic features? The patient has a increase the rate and depth of respiration, and it is called Kussmaul respiration. And also, we can get a special characteristics of smell of breathing. It's called fruity breath odor. Now go for what are the intervention if patient have hyperglycemia. So instruct the parents to notify the healthcare provider when following occur. What does it mean following? In case of hyperglycemia, what are the educate the patient about the insulin or how to collect the insulin, right? And it is important to teach your patient during the sickness. So instruct the parents to notify the healthcare provider when we can see followings. Like blood glucose result remain elevated, more than 200 milligram per DL or more than 11.4 millimole per liter. Moderate or high ketonuria is present. Child is unable to take food and fluid. And child vomit more than once or illness persists. So it is the sign indicate of danger. It is the sign indicate patient are hyperglycemic. We need to management of hyperglycemia, right? So the major complication of hyperglycemia in case of type 1 diabetic, patient develop diabetic ketoacidosis, shortly called DKA, right? So in case of DKA, what we should know, let me read it first. A diabetic ketoacidosis, a complication of diabetic mellitus that develop when severe insulin deficiency occur. The diabetic ketoacidosis is a life-threatening condition. Hyperglycemia that progress to metabolic acidosis occur. So during the diabetic ketoacidosis, what happened? It is diabetic acidosis. because acetone or acidic substance or ketone body formation develop over a period of several hours to day, and blood glucose level when more than 300 milligram per dl and greater than 17.14 millimole per liter. So when less than 200, we call hyperglycemia, also the complication of diabetic mellitus, but when more than 300, we call diabetic ketoacidosis with other sign symptom. And also urine and serum ketone are positive. Manifestation of diabetic ketoacidosis include the sign of hyperglycemia, Kussmaul respiration, and fruity breath odor. It is called acetone odor. Increase the lethargy, tiredness, and decrease the level of consciousness. So, first of all, here insulin deficiency leading to ketoacidosis, how it is developed in the body. Let me explain. So, first of all, like there's some risk factor what is lead to diabetic ketoacidosis, like infection or stressful condition, chronic illness, untreated or underdiagnosis of type 1 diabetes mellitus, or missed insulin doses. When any risk condition or underlying cause, patient develop insulin deficiency, impaired metabolism of fat, protein, and carbohydrate, hyperglycemia developed, and patient present with the symptom of hyperglycemia like fatigue, hunger, weight loss, polyphagia, polydipsia, or polyuria, right? Cellular starvation, ketone body formation and produce in response to cellular starvation cannot nourished and cell become absence of insulin. So the basic pathology, when deficiency of insulin metabolize the glucose and glucose formation energy as a ATP. But when glucose in the body, but deficiency or lack of insulin, glucose are not undergo to the metabolic process. That times fat and protein come in circulation and start to metabolism, produce ATP energy. But during their metabolism, they produce the byproduct. And this byproduct is a ketone bodies. And ketone body is an acidic substance. So pH will be altered, right? So patient develop metabolic acidosis, right? Patient develop metabolic acidosis. So pH going altered here. Now, when ketoacidosis develop, we have to know how to management it. But what we learned last time, so when we go the laboratory test, blood glucose level more than 300, some books said more than 330 milligram per dl, and ketone in blood and in urine and metabolic acidosis occur and also develop hyperkalemia. And here we see the patient present with the sign and symptom like weight loss, frothy breath odor, Kussmaul respiration, means deep and rapid respiration, GI upset, dehydration, and confusion. So what are the treatment options or what are the intervention? So we treat underlying causes. Like if infection, we have to stop the infection. We admit IV fluid and IV insulin, right? So here, also check the blood glucose hourly. We monitor potassium levels because insulin causes potassium to move back into the cell and risks of hypokalemia. And also, we administer bicarbonate for metabolic acidosis. Let me read it with you. The goal is to restore the circulating volumes and protect against the cerebral, coronary, and renal hypoperfusion. So all of this condition attack your kidney, bite your coronary arteries or heart, and leak your brain, right? So dehydration is corrected by IV infusion of 0.9% or 0.45% normal saline solution. Hyperglycemia is corrected with IV regular insulin. So IV insulin is a choice of medication or as prescribed. Monitor the vital sign, urine output, and mental status closely. Correct the acidosis and electrolyte imbalance as prescribed because patient chance to develop hypokalemia, also patient chance to develop hyperkalemia, and both are bad. Both can lead to congestive heart failure. Admin oxygen is prescribed and so monitor the blood glucose level frequently. What next? We could monitor the potassium level closely because when the child receives the insulin to lower the blood glucose level, the serum potassium level will increase. And if the potassium level decreases, potassium replacement may be required, right? So now, the child should be voided frequently or adequately before admitting potassium. If the child does not have any adequate output, hyperkalemia may result. So in case of hyperglycemia or diabetic ketoacidosis, patient chance to develop hypokalemia or hyperkalemia, and we have to correct both or anyone. Monitor the child closely for sign of fluid overload, means maybe patient develop edema or added sound inside the lungs. So now here, so monitor the child closely for sign of fluid overload or intravenous admin the dextrose is added as prescribed when blood glucose reach an appropriate level. The cause of hyperglycemia is treated. So now